Hello, so we're going to discuss about pancreatitis. So pancreatitis is inflammation of the pancreas. So whenever we talk about inflammation, we always think it is caused due to bacteria, viruses, and so on. But here, this is a non-bacterial inflammation of pancreas, and so if it's non-bacterial, then what is it caused due to? It is caused due to pancreatic enzymes itself. Okay, because of pancreatic enzymes only. Next, the etiology. So there are so many causes. So I like to remember the etiology like this. So first, assume this is the pancreas and this is the pancreatic duct. So what should happen is there should be secretion and they should travel. So there should be flow. So there should be secretion and there should be flow. So what can happen is there can be secretion of faulty hormones, like in case of trypsinogen gene defects. What can happen is the trypsin gets activated in the pancreatic tissue itself, causing autodigestion of the whole pancreas. Next, with the flow, there are two things that can happen. It is the flow can be slow, or there can be some obstruction to the flow. Okay, so when will the flow become slow? It is in case of alcoholics, hyperlipidemia, hypercalcemia. Okay, in such cases the flow gets slow because the pancreatic juice is more viscous, and in case of obstruction with gallstones. So now let's look at the etiology. So the etiology is there's hereditary causes where there is mutation of the trypsinogen gene, or they can be slow flow. So slow flow can happen due to alcohol. It can happen due to hyperparathyroidism, which increases calcium, due to hyperlipidemia, which increases triglycerides, or it can be due to obstruction, which is gallstones. And for everything you can remember, you should remember there'll be some drugs causing everything and some procedure causing everything. So drugs such as valproate and iatrogenic causes after ERCP, you can injure the pancreatic duct and this can cause pancreatitis. Okay, so now coming to the pathogenesis, just like we discussed, there can be obstruction to the flow or there can be slow flow. Okay, so whenever there is so slow flow, the pancreatic juice is in the duct itself, so it has lots of time to get activated and it causes autodigestion. So in case of obstruction or slow flow, there will be premature activation of pancreatic enzymes within the pancreas itself. So this causes injury and cause inflammatory response, which we call as pancreatitis. Now, clinical features, always whenever you think about pancreas you should think about three things. One is pain in the epigastric region, which is radiating to the back and which is relieved on bending forwards. Okay, so severe epigastric pain radiating to the back and relieved on bending forwards. These three are classical for pancreatitis. Why is it relieving on bending forwards? Because the pancreas is a retroperitoneal structure. So whenever you're bending forwards, all the other abdominal viscera, are falling forwards. So the pancreatic pain is reducing. And if there is obstruction due to gallstones, there is also bile stasis causing jaundice. This is acute pancreatitis. So anything acute will have those acute symptoms like fever, and increased pulse rate, increased respiratory rate, and toxic appearance of the patient. So the patient looks toxic, there'll be tachypnea and tachycardia, and because of the tenderness, there'll be guarding in the upper abdomen. And the three important signs that you have to remember are the Colen's sign, Great Turner sign, and Fox sign. Okay, that is bluish discoloration in different areas. So if it is bluish discoloration around the umbilicus, it is Colen's sign. If it is bluish discoloration in the flanks, then it is Great Turner sign, and bluish discoloration in the inguinal area, then it is Fox sign. Next, investigations. The pancreatic enzymes amylase and lipase are elevated greater than 3 times the normal range. And then the other investigations that you do is mainly ultrasonography. In ultrasonography, you can visualize the edema, the pancreatic edema, peripancreatic edema can be visualized. And the other test that you can do is CT. In case of CT, this helps in diagnosis of pancreatitis. So for diagnosis of acute pancreatitis, you have something called the Bald-Hazard index of CT. So it includes the following. So I remember it like this: 0, 1, 2, 3, and 4. So assuming this is the pancreas, so 0 is normal pancreas, 1 is focal enlargement of pancreas, okay. So 2 is peripancreatic inflammation, so diffusely pancreas is enlarged. 3 is single fluid collection, whereas 4 is multiple fluid collections, okay. So 1 is okay. So first 0 is normal in appearance, 1 is focal enlargement, 2 is peripancreatic, so around the pancreas, 3 is single fluid collection, and 4 is multiple fluid collections. And for necrosis, you have to remember just two numbers, 30 and 50. So 0, 2, 4, 6 points, and 0 is normal, that is no necrosis, 2 is less than 30, 4 is 30 to 50, 6 is greater than 50. That's it. Now we're going to add these points, and if the score is more than 6, it implies acute pancreatitis, okay. Next is now this pancreatitis can be mild or it can be severe. So to know if it is mild or severe, you use another scale, which is Ranson and Glasgow scale. So according to Ranson and Glasgow scale, I remember it like this. So the two things: first thing that you see on admission, and the other things which you see within 48 hours of admission. So on admission, what all you see, I remember it like this. So it is old, diabetic, who studied law, and whose hobby is to watch football and cricket, okay. So old, that is age greater than 55 years. Next, diabetes, so blood glucose greater than 200, and L stands for LDH, A stands for AST, and W stands for WBC. So LDH is greater than 350, AST greater than 250, and WBC greater than 16,000. Next, within 24 hours, there is H. H stands for hematocrit fall by 10%, greater than 10%, and O stands for oxygen, partial pressure of oxygen, which is less than 60 mm of Hg. The two B's, one stands for BUN, another B for base deficit. And F and C. F is fluid sequestration, which is greater than 6 liters, and C stands for calcium, which is less than 8. Okay, so HOBBY. So H stands for hematocrit, hematocrit fall by greater than 10%. O stands for oxygen, so partial pressure of oxygen less than 60 mm. There are two B's, one is base deficit and other B stands for BUN. So if there is base deficit greater than 4, or if BUN is greater than 5, and F and C. So F stands for fluid sequestration greater than 6, and C stands for calcium, which is less than 8. So C is 4, 5, 6, and 8. Easy to remember, right? So next, you're going to add up the scores, like you're going to give 1 point for each of them, and then if the score turns out to be greater than 3, then it is a severe attack. Then management, so if it is a mild attack, then what you have to do is just give IV fluids. Do not give them any food orally, okay. You're going to give fluid, and the fluid of choice is rendered lactate. And then as there is severe pain, you're going to give analgesics, okay. Whereas if it's a severe attack, there's a chance for complications of all systems, so you have to monitor everything. So you want to monitor vitals, LFTs, RFTs, and the urine output, And then even in this case, you're going to give IV fluids, which is ringer lactate, and then you're going to give total parenteral nutrition, that is nil orally, and you're going to give total parenteral nutrition. And then they can develop organ failure in case of severe cases, so you have to monitor them closely and refer to a specialist wherever required. Thank you.